You're listening to Beat Autoimmune and Thrive, the podcast all about reversing and preventing autoimmune conditions so you can live your most vibrant life as soon as possible. We talk about autoimmune root causes, actionable solutions, and inspirational healing stories. I'm Palmer Kippola, and I used to have MS. Today, I'm an author, a speaker, a functional medicine certified health coach, a pickleball player, and nature lover who's helped thousands of people reclaim their health and their best lives. Let's dive into this episode. Hi, everyone, and welcome. I am with Dr. Sangita Pedro, a naturopath who specializes in helping people reverse autoimmunity by digging deeply into root causes. And those root causes are typically infections and toxins that people overlook. So today, Dr. Pedro and I are going to dive deeply into the topic of digging deeper, what to try when you think you've tried everything or when you're out of ideas, because chances are really, really good that you need to dig deeper. So I'm thrilled that you're here with me, Dr. Pedro. Welcome. It's great to have you back.
Thank you.
Well, let us dig right into the heart of the matter. I know that you are really big on taking care of the gut and starting there when people come to you. So I want to make a general assumption that we're talking to an autoimmune audience. These are folks who have either mysterious symptoms or they have been diagnosed with one or more autoimmune conditions. And the first thing they do is start with food. So let's make the assumption that folks have already eliminated the top allergenic foods. Maybe they figured out their food sensitivities, or we can talk about that as part of the digging deeper piece. But let's just make some assumptions that for starters, they've removed the bad stuff, the gluten, the dairy, the eggs. Maybe they've landed on their perfect foods, their optimal foods. Now what? They're still not feeling 100% better. What's the next step, and what would you recommend that people do next?
Yeah, so that is a common scenario with people that I see. They come to me having tried every diet under the sun, had food allergy testing done, they've removed their sensitivities. And oftentimes if they stick to a very narrow diet path and they, only eat certain foods, their symptoms are kept at bay, but they don't feel great. They might still be tired or not sleeping or whatever their complaints are. And so to me, that's a sign that we need to look deeper at the gut first and see if there's something in there that diet alone just isn't enough to eradicate. So if there are infections or overgrowth or just imbalance in the good flora to a degree that food will help, but we really need to clean it out, clean it up, rebuild, take down the inflammation in the gut lining. So I often start by doing testing. We do either comprehensive stool testing or SIBO breath test if it seems like someone might have small intestinal bacterial overgrowth. And a lot of that just goes based on their clinical symptom picture.
Right. So let's say that somebody just, and this is where the conundrum comes in, is that not everybody has gut symptoms or obvious gut symptoms, because as you and I both know, people tend to normalize things that, I did this for years. I just feel a little bit, bad after eating, but it's not definitive. It's not like run to the bathroom kind of bad. It's just, a little tummy discomfort. So let's talk about maybe some symptoms that somebody might have, and they don't have to be gut related, which is super important. I want people to understand that if you have aches and pains, joint pain anywhere in your body, there's a really good chance that you have gut issues too. So can you just touch on, before we delve into testing, what would be some of the signs that people might be feeling so that this is a sign you need to test your gut?
Yeah, well, to address your first point about normalizing symptoms, I think that's absolutely true, and everybody does it, especially if someone is coming to an alternative practitioner, a naturopathic functional medicine practitioner for the first time. They've up until that point mostly just been in the conventional world. They often don't talk about bowel movements and habits and digestive function to any real detailed degree. And so I talk a lot about poop and burping and gas and bloating because you want to really get the details. And what I found is most people think if they don't have recurrent diarrhea, that everything's normal.
Yeah.
That's the only thing that means something is off, as if you have crazy run to the toilet kind of diarrhea.
Right.
So not true. Like you said, it can be subtle. So in just the gut realm, there's a lot of subtle symptoms, feeling like you said, slightly bad after eating or bloated, maybe a little bit nauseous, but nothing that stops your life or keeps you from functioning. And so people feel like, oh, that's just how I am. It's always been that way. It's normal. So there are a lot of subtle gut symptoms that people might have and they just don't realize. Another big one is people often think that indigestion or heartburn or feeling tension in their stomach area is somehow separate from the rest of their digestive system. And they'll say, oh, well, I get heartburn, but my gut's fine. So there's also sort of this disconnect of thinking that different parts of the system are solitary. And that's also not true. I think something like 30 or maybe 40% of Americans have heartburn.
Yeah.
So any little thing in the digestive system that doesn't feel quite right is possibly an indicator of something being off. But then to your second point of other symptoms in the body, yes, anything that is inflammatory, so headaches, joint pains, fatigue, especially feeling really tired right after you eat, even if it's not a large meal, but just feeling tired every time you eat. Even things like insomnia, even if it comes and goes, pretty much any symptom in the body. Mood changes, another big one. If people have kind of cyclical or mood changes that don't feel attached to anything, that could also be food related, especially really bad severe anxiety or depression. So yeah, there are lots of things in the body that are not directly related to the gut that are likely gut related or gut exacerbated.
Got it. Oh, that's really helpful. And to your point about heartburn and GERD, which is a very popular diagnosis. I mean, these are people, and it sounds like a tangent, but it's really important that people consider that this is actually not a sign of excess stomach acid, right? This is a sign that you need more stomach acid. So can you just touch on that for a minute because you brought it up?
Yeah, this is one of my favorite topics because so many people have it and it often gets overlooked because it's so normal, quote unquote. Stomach acid needs to turn on before we eat. So you should start to think about your food, look at your food, tells your brain that food is coming, and the stomach acid pumps turn on. So before any food hits your stomach should be full of stomach acid so that the moment any food hits your stomach, it starts to be broken up into smaller pieces instantaneously. So if the stomach isn't full enough with acid, or the stomach acid pumps turn on too late. So if you're running around and then you just sit down and eat really fast and you haven't given your brain and stomach time to connect, your stomach acid pumps might turn on a little later after you start eating. And that will also cause heartburn, GERD, reflux, indigestion, whatever people want to call it, because it's mistimed. So both of those things can happen. But absolutely, when the stomach acid is low or not full enough, so the pH isn't strongly acidic, the muscle at the bottom of the esophagus will become loose and it'll start to open up. And then anything in the stomach can potentially come back up into the esophagus. And even the tiniest little bits will be irritating.
Yeah. It's such an important point. And I find that most people over 40 have a lessening maybe of stomach acid production. So it may be important while you're trying to figure out what's going on under the hood to supplement with something like HCl. Is that something that you recommend that people do at least for a short while so that they can actually break down their food further?
Yep. In addition, and depending how bad the symptoms are, for sure, I always have people do a couple things at once. HCl potentially to differing doses, depending on what people need with meals while you're actually eating. So at least one capsule, at least 250 milligrams, potentially more. But it's also really good to just remember the basics of slowing down before you eat, looking at your food, smelling your food, actually sitting, not standing or driving or walking. Those things sound sort of silly, but it really does remind our entire nervous system that food is about to happen and digestion is about to happen. And it makes our whole nervous system just go, and calm down and relax. If we're really tense and stressed out, the stomach acid pumps won't turn on. So it goes a long way in building good habits, which I know you talk to people a lot about, to just remember to slow down a little bit. Eat meals at the same time every day, regular meals. All of that will also help re-educate your system to do things properly. But yes, in the short term, you might also have to supplement just to keep the symptoms at bay.
Okay, well, this is perfect. And you mentioned getting into a routine. So let's continue with your conversation about poop, because it's a conversation that you typically don't have with your primary care provider. And it's something, and I find with my clients that maybe they're not going to the bathroom except once every 4 days. And that's just normal for them.
Yeah.
So talk to me about what should normal look like. I know we're all slightly different, but I really want to transmit this like understanding of what optimal should be, not what's normal to your doctor that you go to, your primary care provider, but
Right.
what would be optimal.
So you want to look at all of the factors: color, consistency, timing, at least once a day, typically at the same time. The body likes routine and schedule. So regular bowel movements at roughly the same time every day is a good, healthy sign. Average brown Crayola crayon color, not too dark, not too light, unless of course you're taking something that makes it darker. But in general, it should be just normal brown, well formed and one continuous piece, not breaking up into pieces or falling apart, or, there's all kinds of variations of what's not optimal. There's a great chart, which I think you know of, the Bristol stool chart, that you can Google online. And it gives you, I think, 6 different versions. And I think it's number 3 and 4 that are kind of the normal range you want to be in, where it's, continuous. It also feels full and complete. So a lot of times people will complain that, yeah, they go, but it doesn't really feel like everything got out. Or maybe then they have to go 2 or 3 more times in the morning before they feel like everything clears out. That's another type of constipation. That's more like spastic constipation. So what you really want is that one healthy, continuous, brown, easy, no straining, no pushing. And I find that very, very few people actually have that.
Yeah. So this is a sign. What I'm hearing you say is these are a good sign. If you're not looking like that every day, at least once a day, then you would be an excellent candidate to have a comprehensive stool test to see what else is going on, because these are all signs that you may feel like it's normal. But if you're looking to optimize your health, if you're looking to reverse an autoimmune condition, we got to start with the gut. So that's what I want to dig into is, what are your favorite tests? And I know it changes a lot, and I know there's new ones on the scene, but maybe talk about your top 3 or 4 favorites right now.
Yeah, it is always changing, and it's a big market where companies are constantly coming out with new tests and adding new parameters. And the biggest thing in the last 5 or so years is DNA PCR testing with stool tests, where they're looking at they're comparing chunks of the DNA of each genome of each known organism to the sample. And those have their pluses and minuses. But I like to do a combination test. So my current favorite right now is, and I don't get paid by the company or anything, is the GI 360 comprehensive from Doctor's Data. It's not perfect, but there's a portion of the test where a technician is actually looking under the microscope. So that's really helpful for yeast. It's still one of the best ways to know if there's yeast at all. Yeast doesn't come up well on DNA testing. So the tests that are only DNA, like GI map from Diagnostic Solutions, often yeast just doesn't show up very well on that test. And then the GI 360 also does a section that is DNA PCR. So you get all of that as well. They look at good flora, abnormal bacteria like pathogenic bacteria, and also just commensals. So bacteria that maybe it's not abnormal, but it's opportunistic. There might be too much of it, or more than you would like. And then they also still do the old school culture and testing. So they'll plate the sample and see what grows to see if there's any excess bacteria, excess different kinds of yeast. And then they test it against antibiotics and different common herbal antimicrobials to see what it's most sensitive to. And that can be really useful for treatment. So that is currently my favorite. There are a few companies in the works right now who are working on doing full genomic testing where they use the entire genome of each organism on the test. And they're still kind of in their infancy. I'm hopeful that they'll get really good. But right now I'm just sort of watching and waiting on those.
Got it. Got it. And I've heard you say this before, and I think this is a really important pearl right here, that if you find any yeast, any evidence, like even if it says rare or few, that doesn't mean that you just have a teeny weeny weensy amount. Talk to me about what that means.
Yeah, so yeast is kind of one of my current favorites, along with mycotoxins, which we're going to get to. Um, Yeast, everyone had candida in the 90s and the early 2000s, and then it sort of fell by the wayside, and it often gets overlooked for other things. But the thing about yeast, and this also goes for microscopic parasites like blastocystis hominis, which is a very, very common parasite that most of us harbor. They both are very sticky and they congregate on the lining of the intestines, and then they hide behind biofilms that protect them from whatever you might be putting in your body to try and kill them. And the longer they've been around, those biofilms just develop more and more and more layers over time. So they become more durable. So you only find in a stool test what gets scraped off the wall of the intestine as the stool is coming out, which might not be much, or it might be dead yeast that doesn't grow when it's plated. But even if you see yeast that's dead, it means that it got scraped off and died somewhere along the way. And that tells me that there's millions or billions more lining the digestive tract that we are just not seeing. And one way to get a better reading for yeast is to have people do biofilm disruptors before they do the stool test. For a week or two. If they feel like they've got, potentially got a lot of yeast, then you might want to even have them do it for 2 weeks. But that will likely get more of the yeast to get scraped off before you collect the stool sample.
That is great. And I've never heard anybody talk about that before. Would something as simple as NAC be a good biofilm disruptor for that?
Yep. NAC is a cheap, easy thing to get. Most people don't take enough of it. So I have people take anywhere from 1,200 to 2,000 milligrams twice a day, morning and night. It's also COVID protective and protective of the mucous membranes in our nose and lungs. And it helps us detox. So you get a lot of added benefit.
That's right.
From it. It's a fairly benign, easy to find supplement.
Yeah, that's perfect. Okay, so now you mentioned yeast. You talked about the stool test. Now we've found a tiny little bit of yeast, and now what? What is your next inclination? Is it to treat immediately, or is there another level of testing that you need, or can we just empirically start to treat naturally, or a combination of prescriptions and herbs?
With gut stuff, I always correlate whatever lab work we have, and that includes blood work, but whatever lab work we have in front of us, you always want to correlate those numbers with the symptoms that the patient's actually feeling. And like you mentioned, sometimes people say they're fine and they don't really have symptoms. But if you really start to ask about the details of how's your appetite, how do you feel after you eat, do you have any bloating or burping or gas, and sometimes that questioning takes 15 minutes to really get all the details. You'll find that most people do have some symptoms, and and with yeast, you can also have extra other bodily symptoms like itching, rashes. Those are really common. Headaches, brain fog, joint pains. In women, recurrent yeast infections. Any or all of those would confirm that yes, yeast is probably a big deal and we need to treat it. There might also be other things going on concurrently. So someone might also have some parasites or an overgrowth of bacteria. So I always start with whatever is the biggest complaint for the person. So if we find yeast and they also have some of these other concomitant symptoms that make me think, okay, yeah, yeast probably is a big part of the problem, then yeah, I would just dive in and treat yeast right away. And I find that because so many people in our culture tend to take antibiotics fairly frequently, even once or twice a year, that will allow yeast, the natural yeast in our gut, to just grow beyond its borders and take over more and more space. So I think most people would benefit from even just gentle yeast cleansing. and using natural herbal things you can buy over the counter anywhere. And I find a lot of times people's symptoms will be decreased just immensely from just treating the yeast. And then other things might emerge as we go along. But yeast is often a big one. And it's tough. It's tenacious, and it can take, depending on the load, it can take 3 months to really eradicate it.
Yeah, this is such a great point. I find that in my practice and collaborating with you, one of the things is that people don't stick with things long enough. And that happens again and again and again. And I know that I've experienced that in my own life. I feel like, I think I'm done with that because I get impatient maybe. I
Mm-hmm.
see people stopping too soon. And what I understand and from our work together, there's no harm in continuing to take things. And you might as well just go for another month. I mean, there's really very little to lose. And
Yeah.
because the yeast can be so tenacious, you got to stick with it.
Yeah. And usually with yeast treatment, things shift over the months. I typically start out with kind of a stronger killing protocol where we're really trying to whittle down just the amount in general, and maybe with pharmaceuticals and herbs combined. And then depending how they're feeling, we maybe shift that up the second month and maybe leave out the pharmaceuticals and do more herbs or switch the herbal formulas. And then by the third month, most people, you're just down to doing a maintenance herbal protocol with some specific targeted probiotics and some other things to help heal up the gut lining. So it's not that you're always doing like the really hardcore stuff. The protocol will naturally shift. But because yeast is naturally in our gut too, it's not an invasive organism. It should be there, but in very, very small amounts. It does help us, but most of us have too much.
Got it. Well, that makes perfect sense. And I think the combo would be maybe nystatin, which is a beneficial as drugs go, one of
Yeah.
the very few beneficial ones, right? And
Yeah.
herbs, because I know some people, might just want to dig into this on their own and order their own stool test and go to town. And what I love about some of these stool tests is that they actually give the recommended herbs that are going to be beneficial against the microbes or the overgrowth.
Yeah.
Sometimes, of course, it's always beneficial to work with an expert practitioner, but there are going to be people that want to just dive into this on their own. So if you have
Yeah.
any favorites, that would
Yeah.
be
I think the ones that the stool test typically culture and sensitivity, the herbs that they use are berberine, garlic, silver, oregano. Those are the ones that are coming to me off the top of my head. I think I'm missing one.
golden seal,
Oh, uva ursi,
uva.
which uva ursi and berberine are both berberine containing plants. Berberine is this constituent. Uva ursi is just the whole plant that also contains berberine. And there are lots of plants that contain berberine: golden seal, Oregon grape, barberry, uva ursi. It's the berberine that yeast is often sensitive to. And there are also just a lot of good yeast combo formulas. Like you walk into Whole Foods, and like a patient brought to me the other day one from Solaray, I think. It's a common over the counter retail brand, and it's just called Yeast Cleanse. And it was actually quite a good formula. It had caprylic acid, Pau d'Arco, berberine, like a nice broad spectrum. There's lots of things that kill yeast. And I have my favorite formulas, but there are a lot of over the counter ones too that work great. But when you're just doing those over the counter ones, you often have to take a much higher dose than what it says on the label. I almost always have people take 2 capsules 3 times a day of whatever they're taking for at least 3 months if you're just doing herbs.
I love that. I think that this is the issue with, you're not healing, you're not getting better. It's either because you stop too soon or you're not taking a high enough dose of something.
Yeah.
So that would be what I think you're saying is, take the recommended dose of those herbs and add half more, something
Yeah.
like that.
Yeah, they often will say twice a day, or even sometimes just 1 capsule twice a day. But with yeast, you really need to be, yeast is one of the things I think you have to dose 3 times a day versus twice. Most things I treat, I do twice a day dosing, but yeast I find really needs consistent, after each meal, something, whatever it is you're using.
Great. Well, anything else on yeast? Because I think the next logical one is mold and mycotoxins, since they actually go together pretty frequently, right?
Yes, and mycotoxins. So mold and mycotoxins are connected but different. Mold is what you actually see on your windowsills or what you see growing on things, and then it's actually like a plant or an organism that produces spores or seeds, which are pretty big in the microscopic world. And those spores we can inhale them, but they can only get as far as our sinuses. And then the sinuses are like a net that stop them from getting into the body any further. But the spores then further release another substance called mycotoxins, which is even smaller. So there's sort of three levels to mold. And the mycotoxins are what can get further and deeper into the body, and they can colonate and they can cohabitate with yeast and parasites, and they can bundle up under those biofilms. So the little biofilms can either be free floating or they can be stuck up against the intestinal wall. And lots of different things can live under one biofilm, not just they're not separate colonies. They can all hang out together. And they tend to help each other survive. They kind of have different niches, and so they don't outcompete each other. It's great. The bugs are helping each other. And mycotoxins are also very small and very sticky. And they can also get into the bloodstream, not just the gut. They can get into all the nooks and crannies of the body. And they are in the fungal world because mold obviously is a fungus. But then mycotoxins themselves are very unique because they're not the actual mold itself. They're a toxin. And most toxins, the human body recognizes and says, hey, that thing shouldn't be here. Make an antibody to it, bind to it, pull it out of the blood, get it out of the body. But in certain individuals, up to a quarter or 25 to 30% of the population doesn't naturally make antibodies to mycotoxins. And so they just float around and they don't get recognized as foreign, and the body doesn't naturally pull them out of circulation. And so they can just build up and build up. And even if your mold exposure was 10 years ago, if you happen to be one of those people who doesn't detox mycotoxins, they're just going to hang out in your system kind of indefinitely until you do something to remove them. Mold is tricky. Mold and mycotoxins can be very tricky.
So let's make it easier for people to start with what are some of the signs and symptoms that somebody would be experiencing to think mold, to think mycotoxins. Let's start there and then we'll break it down.
One of the biggest symptoms is when people say, I always feel worse when I'm at my house, or I just feel like I'm getting sick every time I drive for a long time in my car. Or if I'm at work for 8 hours in my office, I get headachy and I feel exhausted. And then I go on vacation and I feel fine. Or every time I go to my mother's house and sleep in the guest room, I feel sick and headachy. That's a sign that you're probably one of those sensitive mold people and you're being exposed to the mold in one of those environments. It can actually be in your car in addition to buildings, but it's typically in buildings, in the walls, in the floor from some sort of water damage. So that's one of the first things, is just kind of recognizing if you feel just bad and like you're coming down with the cold or flu, but you don't actually get sick, or you get sinus symptoms or headaches in certain environments. That's one sign. And then one of the most common signs is people just getting sick all the time. They get every single cold that comes by, and it lasts much longer than anybody else. And they can never seem to get rid of it. And they get rid of it and they get another one almost right away. So just weakened immunity. And then anything in the sinuses. So chronic sinus infections, sinus pain, sinus inflammation, headaches, and then vision. The vision is another, feeling like your vision is blurry. Even if you wear glasses, feeling like, you're looking down and reading, and then you look up and it takes a minute for your eyes to adjust, like long enough that you can notice it's almost like you can feel the lens not quite focusing. Yeah. That it's called accommodation. And when that accommodation is very slow, that's also a sign of mycotoxin. And there's a lot of other things that could happen in the body, like joint pains and body aches and feeling like you're getting sick. But I think the big common ones are what I mentioned.
That's great. And there's a really simple test that people can do that's
Yeah.
virtually free called V as in Victor, cstest.com, right? VCStest.com. And that's actually going to test your vision to see if you can see particular dots, which are very, very faint and very
Yeah.
difficult to see. So I actually get stressed out taking the test because because the dots are super hard to see. But what this does is it shows if you have exposure to biotoxins, and that might be mold. So it's maybe a first step. Would you say that that could be something that people can do for themselves on their own, on your laptop, on your computer? Go to vcstest.com,
Mhm.
$10 donation, take the test, just do it so you have a baseline, and then you can track it over time.
Yeah, and the test is not specific to mycotoxins. Like you said, it's biotoxins. And that particular test gives you two different numbers, and they do each eye separately. So one eye is often worse than the other. And it will tell you if you kind of have general toxic load, but it doesn't say from what. And then there are more the biotoxins, which are mycotoxins and such, that if that one is higher, it's more likely you have mycotoxins. But it's not specific just to mycotoxins. It's a great way to follow treatment. So if someone's test is way off at the beginning, they suspect they might be having a mold exposure, and then they get out of the moldy place or they clean it up and you start doing treatment, and then they do the test a month or two or three later, and suddenly it's cleared or it's better but not quite gone. It's a nice, cheap, easy way to track treatment progress.
I love that. So let's say the person, they did that test. It's clear that they've had the mold exposure. They know they've had water damage. Do we do a body test of mycotoxin burdens next? Is a urine test the next best place to start, or would you do a home plate test? Where do you like to start with people?
Well, both. I mean, it kind of depends on the person and what they want to do, but definitely the home or whatever environment they think they're
Yeah.
um, being exposed from. Because if you're constantly being exposed, you could detox all day long and you're just going to keep getting more and more and more into your body. And so it's a little bit of a futile effort because you're just not going to be able to detox fast enough. So the first thing is really figuring out where the exposure is coming from. And if it's not current, if we found out it was just an old exposure from 10 years ago, then great. At least you know that you're not being currently exposed from your house. So I would definitely test the house, especially the rooms you spend most time in, and any rooms you've noticed that you feel bad in.
Right.
You can't really do that at work. I mean, you could maybe on the sly do a little plating test in your office or something. That gets a little trickier, but your house for sure. And then the mycotoxin urine test, there's a couple of companies that do it. And it's a great way to just know which types of mycotoxins are in your system. So people could do those both at the same time. But again, you really need to get yourself out of the moldy environment before you start treating. So even if the urine test comes back and shows high mycotoxins, you've got to take away the constant exposure. You can start treatment, but it's never really going to fully get rid of it until you get out of the environment.
Yeah, that's such a good point. And this is one in the category of digging deeper. I find that sometimes there's a knowing doing gap, and this is such human nature is, when somebody knows they've had a mold exposure, knows they're renting a home, and we were in the situation where the landlord just didn't want to remediate the place properly. So that put us in a situation. It's like, okay, we have a choice. I can stay in this moldy environment and get potentially worse, or we can pay for the remediation on our own and do it right, or we can move. I mean, it really comes down to that, because at the end of the day,
Yeah.
if you continuously expose yourself to the mold and the mycotoxins build, it's not a good situation.
No, and especially if people have multiple things going on. So often, if people have mycotoxin sensitivity and they're having exposure, they usually have other things too. They might have some gut dysfunction. They might have Lyme disease. They might have heavy metal toxicity. I mean, it's kind of rare to find someone who only has one thing going on. I mean, I have seen it, but it's definitely not the norm of what I see. I think people have at least 2 or 3 things going on. And if they're really sick and, really bedridden or really fatigued or, just pretty severe, it's likely that there's a little bit of everything going on. And so anything you can remove, like you talked about food at the beginning, that's something we can control. We can choose what we put in our mouth. Well, we can to some degree choose what environment we're in. But going down the mycotoxin and mold road can be daunting to people because they've heard all these things like, oh, I'm going to have to pay all this money to remediate my house, or I'm going to have to move. And I get that it is costly, it's time consuming. But if someone's really, really sick, I think it's very much worth the money and the time because it's a huge wrench in the human immune system. I mean, mycotoxins, if you're sensitive to them particularly, could be the thing that if you get rid of it, it's like just your immune system is just going to be able to come alive again.
Yeah. Oh, that's so well said. And I think when we talk about all of these things, what we're really talking about is immune burden, right? So it's all of these things fill the toxin bucket. And theoretically, we're supposed to have the holes in the bottom of the bucket where we excrete things and our immune system can just fend them off. But with all of the layering on and then the stress that just adds to the conundrum, I mean, we're filling the bucket way faster than we can excrete. And we'll talk about detox in a minute, but I don't want to forget testing, urine testing for mycotoxins. Can you give me 2 of your favorite urine tests?
The only 2 that I ever use are Great Plains, which has been around for a while. I think Great Plains tests maybe 10 different mycotoxins. And then Vibrant Wellness has been my new favorite recently. It's about the same price and they test for 30 different mycotoxins. So, for basically the same price, you're getting way more types of mycotoxins tested. And it's the same test.
Yeah.
Like they're using the same technology in both places. So
yeah,
those are my 2 favorites.
That's great. And if you find that you have those mycotoxins in your body and you also test the home, and keep in mind that air testing, a lot of companies that do, home, they come in and do an assessment before you move into the home. They just do air sampling, which is not a great way of finding out if you have mold exposure in the home. A far more effective way is to do the plating that we've been talking about because things land, right? It's in the air, but then it lands. And that's the stuff that you want to test. So you want a company that uses those plates. And Immunolytics, am I saying that right? I think it's Immunolytics, does home plate testing, and that's relatively inexpensive. And you want to make sure you get plates for every room that you spend time in.
Mm-hmm. Yeah. Most of the mold does land and the spores land on things. They don't just float around. And that's part of the problem with remediation. When you start to actually clean up mold, you have to disturb the mold colonies in order to clean them out. And the minute you disturb a mold colony, like you wipe it off a windowsill, it senses the danger that it's being exterminated and it just releases spores and toxins wildly into the air, which is going to make any sensitive person feel infinitely worse. So you never want to be in the house even if you're just doing cleaning of it yourself in the short term. If you're the sensitive person, you don't want to do the cleaning and you don't want to be in the house, and you never, ever, ever want to spray bleach on mold. Bleach turns mold into a more toxic substance than even just the general mycotoxin. So don't do that. Use essential oils and hydrogen peroxide, and there's safer ways to do it, but steer clear if you are a sensitive individual.
I love it. I love the idea of doing essential oils. Is there one in particular that is an anti-mycotoxin or spore?
Yeah, there's some great. So Jill Krista's book, which I can't remember the name of right now, is a great, easy to read. She's got all kinds of great do-it-yourself sorts of things and references in there, but including essential oils. But the ones that I kind of keep on hand, I just have a spray bottle that's half hydrogen peroxide, half water. And then I put in like 8 to 10 ounces of water, I'll put in like 40 or 50 drops of essential oil. So pretty strong. And you can use any tea tree, clove, lemon, pretty much any of the trees like eucalyptus, fir, the herbs, thyme, rosemary. There's others, but those are kind of the big ones. I usually pick a few, like I like eucalyptus and lemon and thyme together. I keep one in my shower if there's, to keep mold from growing, or works great in your car. You can spray down areas if you think there's been mold and then just let the heat of the car sitting in the sun kind of bake it out. So yeah, I love essential oils.
Fantastic. That is such a great DIY tip for people, especially if you're in a situation where you can't really do anything about it right now and you can't afford to like completely remediate your bathroom. This is something that you can spray. And don't forget to check behind things like dishwashers, washers and dryers. These are typical places for water damage that people often don't find, right?
Yeah. And in the walls and in the floors. And that's why if you're really serious or you own your house, you really want to have someone come in. Like if you do the plating test at home and you find high levels, the next step is to have someone actually come in and find exactly where it is. Like, okay, you know the room, but now you need to know, is it in the ceiling, in the wall, in the floor? And the companies that do it well are really good at that. So that way you don't have to tear apart your whole house. You know exactly where it is. And they know how to do the remediation properly to keep the toxins lower. But you don't want to be in your house while they're doing it.
Right. And it's really important to get a good person that knows what they're doing. And I think we have one in the Bay Area, Environmental Sciences. I mean, these are people that really are good. They're not just going to tear things down and, bleach it and call it a day. I mean, this is where you really need to educate yourself about this. It is a tenacious problem. And if you do a half-assed job with mold, I'm sorry to say that it's going to be an ongoing problem.
Yeah, and one of the big complaints or questions people often have about mold is, well, but mold is everywhere. So it's a futile effort, right? Like, why do all of this? Because mold is just everywhere. And it's true. I think if all the humans died tomorrow, mold would take over the planet pretty darn quickly because it is everywhere. But you have to remember we're talking specifically about people with illness and autoimmune issues. If everyone in a household is not sensitive to mold, then it's probably not affecting them to any large degree if it's very small amounts. But if you have one person in the household that's very sensitive to mycotoxins, they're going to feel that, and they're going to feel it really strongly. And sometimes it's hard to understand that when you're the person who's not sensitive, because you're like, I don't get it. I feel fine. But they're not making it up, I promise. I am one of those sensitive mold people, and it took me a long time to come to that realization. I had to kind of go through the exposure multiple times to realize it. But once you definitively know the symptoms that you get from mold, they're really clear and they can be very debilitating. So doing it right, like Palmer said, like making sure that you're getting the mold out for that person's ultimate health, it really, really does make a difference.
And that's a wrap. Thanks so much for tuning in. If you enjoyed this episode, be sure to subscribe, share it with your friends and family, and if you feel inspired, please leave a quick review so other people can find it too. Now, if you want to beat autoimmune and thrive, make sure you sign up for my free video training at freeautoimmunetraining.com. That's freeautoimmunetraining.com, and watch the first video right away. Take good care. Bye for now.